These 9 patients is quite a small cohort. We actually presented them at the ISA meeting in Heidelberg, and when we looked, or when we were thinking what could we present at this meeting, we looked at this patient population 3 years after a 3 years follow-up, and we realized that we were quite surprised that they all were still alive. And despite the fact that they were quite old at diagnosis, so they were 67, had a median age of 67 years, and they were all quite advanced stage at diagnosis. So they were a revised Mayo stage 3 to 4, or European modification 3A to 3B, so quite an advanced stage population. And when we all started them on Venetoclax in a second-line therapy, and I think what is quite astounding that they were heavily pretreated, so they had a median prior lines of therapy of 3, and all had daratumumab. They all harbored a 1114, and histological workup showed that they had a BCL2 expression of over 50% in their plasma cells. So we did expect that they would respond to Venetoclax, and they did. I mean, we had 2 VGPRs and 7 CRs, so we had a response rate of 100%. And despite the fact that they all had cardiac involvement, they responded quite well from a cardiac point of view. So 6 of our 9 patients had at least a PR and are still doing quite well, which is very good for them.